just the value of the data that GI has. I think, it's one of those rare industries. When you think about all the information you have as a GI owner, as a GI facility, right? I think, if you just look at blocking and tackling, right? What can you do in your practice and business today using the information you have? And maybe it's on a piece of paper, which makes it harder, but what can you do to give yourself a competitive advantage?
Dunston Almeida, founder and CEO of triValence. Thank you so much for coming on the Scope Forward show. I'm really looking forward to having this conversation.
Nice to meet you, Praveen. Very excited. I've had a lot of great guests on this show. And so hopefully I can live up to some of the past guests you've had here.
Yeah, I think you surely will. I'm really excited about what you've built and so quickly, and I'm eager to learn more. But before we get started, Dunston, I have an AI assistant introduce you. So let's get started with that. Here's Jenny.
Introducing Dunston Almeida, the dynamic founder and CEO of triValence. At the helm of this next-gen B2B purchasing, e-payments, and real-time data platform, Dunston is revolutionizing the medtech and medical distribution industry. triValence is all about streamlining the connection between ASCs and suppliers with its innovative supply chain automation, payment optimization, and market trend analytics. It's not just a company, it's a game changer in healthcare tech. With a remarkable 25-year career, Dunston has left his mark at major healthcare tech companies. He was a pivotal member of the executive team at Xeelys, contributing to its $5.7 billion recap, and played a key role in growing Evicore's revenues to over $3 billion in less than 4 years. Dunston also brings his expertise to Purple Labs as a board member, a leading health tech analytics firm. His journey in tech and healthcare began at Cornell University, where he earned a degree in electrical engineering. Dunston Almeida is more than a CEO, he's a visionary leader, reshaping the future of healthcare technology with triValence.
Wow. I think I should be interviewing that AI assistant, Praveen.
She does a good job. Dunston, that's an amazing background. I know we got a little bit insight into what triValence does, but let me start by asking you a very basic question. What does triValence as a company do?
Very fundamentally, right? We said that triValence would try and fix this massive inefficiency across the entire surgical center industry in the way in which they order and pay all of the products and services they need to perform surgeries or procedures. And what we found is the ASC industry hasn't adopted technology and automation the way that, perhaps hospitals or health systems, other part of healthcare have. And when we looked at the amount of waste and inefficiency in ordering supplies, goods, materials, managing them accurately, billing for them accurately, invoicing them, and then paying for them and getting the data into, what was paid, how much the price is going up. We found that the ASC industry and GI being one of the subsectors of that were actually, further behind than we thought. And we said, is there a much cheaper, faster, better way to do this on behalf of all the providers in this industry? So, this is not a payer-provider battle. This is just purely, let's get some operating inefficiencies out of the way and make the GI industry, for example, do more procedures and offer a better patient outcome.
Just going to the basics, so is this software platform that you have built? So how does it do what you said, it does?
Partly a software platform in that you can go out there, and we actually have built the only what we call B2B network connecting every major medical device manufacturer, distributor, and the ASC industry. So we are electronically connected to, the J&Js, the Medtronics, the Strykers, the Zimmers, the McKessons, the Cardinals, the Henry Scheins on the distribution and medtech side. We're also connected to a lot of the ASC providers, right? The GI practices that use our solution. But the important thing is the software automates the ability to go out there and purchase, from all the different things you need, from bandages and gauze all the way through scopes and, implants, right? But the part that's really interesting is we actually then take all that information and we electronically pay the Medtronics and McKessons of the world And the part that is very interesting to, the med tech companies in particular is we give them real-time data on, is the invoice, the purchase order, the payment matching? And the reason why that's important is, as you guys know, practicing healthcare as doctors, there's a discrepancy between how much you used, what supplies were actually consumed on the OR, how much was actually paid for by the insurance company. And then there's always disputes with the actual company you're purchasing from in terms of, what was actually done. So we do an electronic four-way real-time data reconciliation. We send that over, we make the payment, and then this is the best part about it, right? The best part is now all this data, instead of being lost to paper and fax and email, is now captured electronically, and we aggregate that data, and we can provide a Medtronic or a J&J on the medtech side, real-time insights, for example, into what's happening. What are the trends you're seeing with your orders across the entire ASC industry? So, the ASC industry, 7,000 plus organizations, right? So it's a very big, diverse, fragmented industry. But that real-time data is really the heart of what we do. We have a lot of surgical centers telling us across the board, doesn't matter if it's GI or dermatology or ophthalmology, saying, I want to know what I'm purchasing so I can do benchmarking, case costing, cost per implant, cost per patient, so they can better manage their business. And on the supplier side, they're saying, hey, I want to get aggregate de-identified data. Am I losing market share to my competitor? Am I gaining market share? Why are volumes spiking up in the Northeast versus the Southwest? Should I be putting more of my sales effort there? Should I be upselling them on a better product, a newer product, a more higher margin product? So we created this network, right, by saying this combination of software and data will really help everybody get better at what they do. It will help medtech and med distribution sell better, sell more effectively, and will give the ASCs more insights into, what their supply chains cost for them. Honestly, Praveen, one of the other things, you mentioned this when we started, COVID actually changed the dynamics, right? Because inflation skyrocketed, labor costs skyrocketed, and a lot of the CFOs are now looking at the operational costs and saying, well, if my labor costs are so high, my staffing costs are so high, and my material costs are so high, and reimbursements flat to slightly up, how am I going to get more efficient, right? And so this became an efficiency play, a lot of the specialties within the surgical center space. And one of the other things we discovered, very, very, very few folks in the healthcare supply chain use electronic payments. I know it's shocking to believe. You get your paycheck deposited, every 2 weeks without question. But the vast majority of surgical centers are still paying with check. Sometimes they'll use a credit card, but it's very expensive. We built our own payment network to say, okay, you know what? We'll let you pay electronically with a direct deposit. You can pay with a check. We'll transfer this information. But what we'll do for you that no credit card company will do is we'll give you real-time data and make it really valuable for you. And we found that has been a huge selling point, because as we saw from a lot of the big med tech vendors and suppliers, they're getting inaccurate information. They're getting checks that are lost in the mail. They're getting checks that are delayed 45 to 60 days after the payments are due. They have to finance that because they're going, well, you were supposed to pay me in 30 days, but you're paying me in 45. I multiplied that by 5,000 ASCs, and all of a sudden I've got billions of dollars of working capital, right, tied up. So there's some big dollars here. And then there's a lot of order inaccuracies when you're using paper or fax. Something got misplaced in terms of the number. You actually meant to say 50, not 500. Our solution just tries to put it all together, reconcile it before the error happens. What we can call, Praveen, you as a healthcare entrepreneur know exception management. So before the actual error happens, you flag it and say, hey, watch out for this because this looks, somewhat off. And so really that's how we've constructed the solution. Although we're young in our journey, a couple of years old, we've seen a lot of adoption and uptake across, various specialties. And GI just happens to be one where we've got a lot of great feedback from some of the leading players in the industry.
Very interesting, Dunston. So if I have to understand, what triValence does in a different way, at least a part of what the company does is being an Amazon for surgery centers, but a B2B Amazon. It's one business on the other side, another business on another side.
It's buyers and sellers connecting.
The gateway.
Right.
The big innovation is connecting the dots with all these different vendors or medtech companies that are selling to surgery centers, and also connecting the surgery centers through a network software platform platform. And another innovation that you talked about is payment gateway. So therefore, the money is not lost, it's tracked, and also there are no errors being transmitted from
Right.
one to the other.
Right. It's a great analogy. Yeah. And you know what makes B2B purchasing in healthcare complicated, Praveen, is, on Amazon, you can go out there. If you search for shoes, you'll get 8,000 varieties of shoes. Healthcare, we have 8 to 10 million SKUs. You can search for surgical screw and you'll get, I don't know, thousands of, there's a very specific type of surgical screw you might use for a very specific procedure. So we've aggregated all of that product data down to the SKU level. So you know exactly what you're looking for. And you go, well, this is the kind of screw I really want. But then the other complexity in B2B is, you've got GPOs, you've got contract prices, you've got special vendor pricing. And what we don't do, we're not Amazon like a marketplace where you're comparing prices, but we make sure that all your contracted prices are in there, whether you've got a special rate through your hospital purchasing affiliation, through your GPO, or directly from, Medtronic maybe, right? Maybe Medtronic, you're a big buyer and they give you an amazing deal. And you know this particularly well. The data is very, very hard to consolidate across GPO, device company, distribution company, because the same surgical screw is described differently. So we harmonize that data, we aggregate, harmonize, and then normalize it. So when you, as the physician, go, I want this screw, we know what you're talking about, right? You're like, okay, you don't want the Medtronic one or the Cardinal one, you want this specific one. And that was, one of the biggest technological challenges that is out there. Healthcare data is just not efficient. So to take the Amazon concept, imagine you're going to Amazon, you want to buy that shoe, but now you're talking about, I want a shoe size 8 with, plastic, and it has to be manufactured by Nike only. And by the way, it's got to look, it had green stripes on it, because that's exactly what I need for my GI procedure, right? So how do you do that and do it fast and efficiently, as opposed to what happens today, which is, a nurse manager, physician assistant is working on behalf of the doctor or the surgeon and saying, okay, doc, what would you like? And how many do you need? And let me put a phone call into the sales rep. And, if you're lucky, it shows up in 4 days, right? So that is the friction that we're removing.
Dunston, I want to go back in time. You started the company in the COVID period. You said it's a couple of years. I have twofold, question. One is, what about your background got you here? Going all the way back, your father is an orthopedic physician, and I'm sure that gives you insights, but also your previous companies and what you've done there. What about that background gave you the idea to start up triValence? The second part question is, in these last 2 years, because what you've done seems to be quite a lot and it is complicated. So I'm curious to know how you went about it so quickly.
So my dad was a, small practice orthopedic surgeon. And like a lot of surgeons of his generation, say baby boomers, I guess, he was pretty tech phobic. And I saw how inefficient a lot of he cared about the patient, he cared about the outcome, he cared about doing the best possible surgery. But there's only so much he could do. And he was very used to paper and was scared of using more than, an EMR. And even that he didn't like. At the same time, just instructively just watching that experience. And I'd spent time on the payer IT side of healthcare, watching plans and employers and TPAs. I'd spent time on the provider side of healthcare, seeing how providers were billing, doing revenue cycle, getting claims submitted, disputing claims with payers. And I would also spend time, my first job in healthcare actually was on the distribution side, on the pharmacy distribution side, which is a very automated industry. They have these big hubs and warehouses where they distribute drugs. We knew all about this through COVID, of course, but again, a very manual, paper intensive process. And so during COVID, when I was just thinking about, what I would do next, I said, wait a second, why is it that in the healthcare supply chain, we are still using paper and fax and email and ordering via the phone and trying to figure out via a paper spreadsheet or an Excel spreadsheet how millions of dollars of purchasing happen, right? It's one thing if I'm spending $50 at home, but these people are spending millions of dollars every month, sometimes every day. When it all came together, I started doing some research, Praveen, on the surgical center industry. And what I realized is hospitals and health systems have invested hundreds of millions on these, very big EMRs, right? Epic and Cerner and whatnot. Surgical centers are nimble, they're fast. They don't have that kind of capital dollars to spend tens of millions on complex EMRs or revenue cycle systems. They want cheaper, better, faster, with the best possible outcome. And I think everyone knows that. Payers want you to go to an outpatient facility, to an ASC, because they know the outcome is better and the outcome is also much more preferential for the patient. So when I looked at the industry, I said, okay, fragmented, a lot of paper, a lot of waste. I just, again, knowing from my dad's experience. And then from my healthcare tech experience, I said, why isn't anyone doing this? And the reality is because it's hard. What I just described, building a network, connecting to all of these folks, getting a product catalog, aggregating it, cleansing it, and then doing electronic payments, which, by the way, healthcare is not set up for electronic payments. We just never built our healthcare infrastructure that way. It was hard. Second part of your question, it took us a long time to actually build the technology. It took us more than a year to actually refine it. We had some great pilot customers that we, used as betas to refine. Here's what we need. We got feedback from clinicians directly, from physicians, from surgeons that were practicing from primary care all the way through to GI experts or subject matter superstars in orthopedics who said, here's what I deal with every day in the OR. And we refined it. And we said, okay, let's just go out there and see how this works. Let's make sure we can build it for scale. And the flip side to that, Praveen, is even though we've been around for only 2 years and I've got a lot of traction, we also recognize that healthcare, is slower moving by definition, right? Because we care about the patient. You can't just go in there and say, hey, I'm going to build some brand new AI product and everyone's going to adopt it, or whatever the latest whiz-bang technology is. You got to be very thoughtful about adoption and usage and the customer experience. And so a lot of our effort in the past 2 years was, what is the right customer experience? And by customer, I mean the doctor, the provider, the surgical center, the nurse manager, right? So it was that combination of feedback loop, just engaging directly with the folks that were doing the work on the ground that, have given us sort of this palette of opportunity to go out there. And at the same time, we also said the surgical center industry is very big, right? I mean, you can define it any way you want, but there's at least 7,000. If you include Medicare, there's probably 11,000. I think the latest data says that, the entire surgical center industry is $80 billion of spend, but it's going to 130 billion in 5 years. Meanwhile, the hospital industry, as you know, is shrinking, right? So this industry is exploding, and each specialty has a different flavor, right? What ortho is doing, what cardiac is doing, what multi-specialty is doing is about the same, but slightly different than what GI is doing or ophthalmology is doing. But the chassis is the same, right? The problem you have with purchasing friction, payment inefficiency, and data is the same. Actually, you can go to home health and post-acute in a nursing home and have the same problem. It's just a different set of people that you're buying from and you're paying. So GI became a natural interest to us because we kept hearing from GI folks that were expanding. They were owned by private equity. They were looking to acquire the facilities. They were smaller singles-owned facilities that were all saying the same thing. Hey, I'm really growing fast. I'm trying to get ahead of the cost curve. I'm trying to manage my expenses better because I know how important staff are in this environment. And I don't have visibility. I don't have good data into what I'm doing. And GI is a good example because it's very high volume. Even though each individual component might not cost as much, it's very high volume, right? You can do a lot of procedures in a day at a single site. So when you add that all up, it adds up to real numbers. And inflation in the past 4 years is 30%. Guess what? It's expensive. So how do we give the CFO and the CEO and even the nurse manager insight into what's happening with all of this? So that really was, drove adoption. The last thing I'll say, Praveen, is, I think it's a very, very astute question you asked. How did you manage to build this in just 2 years? We didn't have to rebuild the wheel here, right? If you look at our consumer tech, you give the example of Amazon. But think about what you use every day. You use PayPal, Venmo, Zelle, you use your credit card app. You do all of this stuff electronically. You don't blink an eye to send money to your brother or your friend to split a bill. And yet in healthcare, God forbid you actually would think about using electronic payments. So when you think about all these companies that have innovated, we actually use them as building blocks. We said, we don't have to recreate the payment architecture, right? There's networks, there's credit cards. What we have to do is create the language layer of healthcare and make sure that it's customized for the needs of the surgical center industry. So that helped us accelerate it. So we're not recreating, how do you pay with a credit card, right? There's ways we can do that. How do you pay with a direct deposit? We can do that. But how do you do it for Medtronic and Stryker? that's where our expertise in healthcare came in. And it's been a fascinating journey, honestly, along the way.
Very interesting. Now, earlier when we were chatting, you compared the ortho surgery centers with the GI surgery centers. You have very interesting viewpoint because you're looking at these surgery centers of these different specialties, derm, ortho, GI, and so on. I'd love to know how forward or backward gastroenterology is compared to all these other specialties. And once again, please don't be kind. I'd love to know exactly how you see it.
Yeah, I think, first of all, it's a really interesting comparison because if you think about the history of the surgical center industry and the move from, inpatient to outpatient, arguably ortho was the first big one, right? I mean, 10, 15 years ago, you could go to conferences and people were talking about how if you wanted to get a hip knee joint replacement done or a shoulder surgery done, you'd go to an outpatient facility, and payers were still thinking about this, right? So if you look at the evolution of the ASC industry, again, broadly speaking, ortho was the first big one, and then others started following through. And then as the industry got more institutionalized, as chains like USPI and Tenet and Surgery Partners came on board, they started saying, well, if I can get better outcomes at a cheaper cost with a much better customer experience, what else can I do there? And eventually it ended up being, multi-specialty, right? Whether it's GI or derm or ophthalmology. But my own perspective is that because ortho was the first, and you saw the really big chains there, both private equity and public, they were the ones to actually invest in some degree of technology, right? I'm not saying it was whiz bang. Certainly what a surgical center might do is very different than what a Kaiser or an Intermountain or a very prominent health system might do. But they have more complexity, right? You're looking at one very particular specialized line of business. And we stumbled upon GI accidentally because we said, okay, we're looking at ortho, and then we came across more multi-specialty sites, and they said, hey, I'm doing all of these different things. I'm adding more facilities, I'm building de novos, I'm rolling it up, I want to do JVs. And what was interesting about GI was that a lot of folks I talked to, even as early as 2 years ago, right, when I was doing research and talking to a lot of CEOs of ASCs, saying, what's interesting to you? Is this a problem that you have? And they'd all say, yeah, I have this huge problem. But what was interesting about the GIs was they knew there were problems here, that there were inefficient things happening, that they could get better at it. They didn't have enough scale or data to really get to where they need to justify an investment, right? Hey, do I really need to go out there and figure out what my case cost is, or what my, margins are per procedure, per patient, per colonoscopy or per surgical procedure? And over the past 2 years, as I started having more and more conversations, we started meeting with more larger GI facilities. I think some of those trends intersected where the GI practice was saying, we got to scale because we'll get much better. We can attract more patients. We can get economies of scale on purchasing and on potentially maybe, get better at filling open labor positions. And at the same time, the innovative GI folks, right? In some cases led by private equity, in some cases not. But they started looking at best practices in orthopedics and some of the other pioneers, if you will, and saying, hey, how come those guys have margins of 25 to 30% and our margins are 20%, right? How come the best in class orthopedic site is operating a more complex procedure with, and reimbursement plays a part into it, of course. How are they getting those kinds of efficiencies? So I think we're sort of in, maybe the second or third innings of that on the GI side. I think it's still early days. I think the GI industry probably can benefit tremendously from some of the things that you've already seen, in orthopedics. And we know there's a lot of device innovation happening, right? When you look at some of these new AI-enabled scopes, and there's a lot of innovation coming down the pike. And I think the question that I keep hearing from some of the GI folks is, one, can I scale with what I have? If I added 10 more facilities next year, whether de novo or acquisition, do I have the infrastructure to scale? Can I do 10 times more procedures? Or is my back office just going to rely on, 10 people to process payments and manage contracts? How do I get ahead of the cost curve, right? Inflation's coming down, but it's still very high. And if you're a CEO, CFO, COO, you're going, shoot, my reimbursements by Medicare went up 3%. Commercial payers, depends how much scale I have, but then my costs are going up 10% a year. Like, that's not a good model, right? So I think that's what the GI industry is. They're trying to figure out, what's going to get me to that next level of of scale and efficiency. Again, you know the industry a lot better than I do, but I don't think GI is quite there yet. But maybe in the next couple of years, they'll be in a much better position to determine what that looks like.
Given your background from the industry, how do you see things playing out in GI over the next 3 to 5 years? Big focus of the Scope Forward show is to talk about the future of gastroenterology and medicine in general. You're representing a financial background, a private equity and hedge fund background as well. I'm curious to know from the viewpoint that you have, how do you see the business of gastroenterology playing out over the next 3 to 5 years?
First of all, it's a great question, Praveen. And, it's fascinating because I'm going to give you an example of radiology. So about 8 to 10 years ago, when I was in the payer IT side of things, I was part of a company that managed a lot of imaging and diagnostic facilities. And again, this is, when AI was not very cool. I'd acquired a natural language processing company from Mass General that looked at unstructured data in a medical record or clinical record and tried to synthesize it. Hey, Praveen, he drinks too much, very clear. He's 45 years old and he has a couple of comorbidities, a couple of chronic conditions. If I compile that against, the electronic medical record and use some imaging data, does that give me a true longitudinal picture of Praveen? And can I perhaps be preventive? Can I say, Praveen, you should come in before you get a heart attack or, before you end up getting admitted to the hospital. And what happened in radiology was some of the same influences happened, right? There was a lot of consolidation, a fair amount of private equity roll-ups and interests. And then all of a sudden now in the past, let's call it 6 to 12 months, people are talking about, can we use truly artificial intelligence to use some of that diagnostic information and help radiologists get better, help teleradiology get better. They've had the same pressures, right? Reimbursements has been declining. The industry is getting commoditized. And so they're all trying to figure out what is the ways in which I can distinguish myself. Is an MRI equal to an MRI equal to an MRI no matter where I get it? It's just a matter of price comparison. And so I think the GI industry, if I were to draw a parallel, right, and say, where would it be in 5 years? I think you're going to continually see this adoption by private equity and other third parties who want to roll up the industry, because that's a proven way of just getting better payer contracts, right? And the reality is, the bigger you are, irrespective of what you do with your infrastructure, you want to get better payer contracts, and then it manages your revenue cycle better. But then the question becomes, what is distinguishing you, right? What is it about your practice that makes you stand out in a world where, if you believe the zealots in Silicon Valley, AI is going to eat the world? And, what IBM's Watson said 10 years ago, they said radiologists will be obsolete. They changed their tune fast, but, the product didn't go anywhere. So I think the real question, for many of the folks in the GI landscape is, where do they want to be from a differentiation perspective, right? Is it a better patient experience so I can go in there, get a quick procedure done, pay electronically, see everything explained to me, have a great experience with my doctor? Or is it something that, unfortunately, what happened to radiology, where it got so institutionalized? Like, you go for an MRI now, you don't care. You're like, I just went in there, got a CT scan, the guy showed up and boom, I'm out of here and I'll never hear from him again, right? So in a way, they've lost that patient touch. Big corporate interests came in and said, okay, well, this is just a one size fits all. We're going to make it one size fits all. Clearly, GI is nowhere near that today. And so I think the real question is, we know consolidation is going to happen in this space, but who are going to be the true winners here, right? Which of these regional or perhaps even national GI virtual value-based care alternatives pop up? Because that's where the real opportunity is. Who can go out there and say, I've got a very inexpensive, efficient business model. I can do a value-based contract. I can get a great fee-for-service contract with United. And oh, by the way, I've got a really well-functioning operation on rev cycle, on purchasing, on my back office, so that if I decided to go out there and add 40 more clinics, I'm in good shape. It's okay. My system's not going to fail me tomorrow. I think that, in Wall Street, the word they always use is institutionalization, right? I think you're seeing that evolution of family to small practice to a small number of locations to very large number of sites, right? 100, 150. What is the right size to get a GI company to become truly transformative? And I think, if you look at SCA, if you look at, Surgery Partners, I guess, you look at some of those big names that started with orthopedics initially, right? And then expanded. they've become brand names almost, right? I think that's the real question I have is, can we create a GI brand name on the GI side of the world that brings that unique experience?
As we begin to wrap up our conversation, Dunstan, I have a thought experiment here. You mentioned SCA. Now, SCA is part of Optum. Optum is part of United. What I want to pick your brain on is, where do you think all this is going? And you said, what is the right size? I don't know if there's a optimal number here, but wearing the hat of someone sitting in New York, Wall Street, and from that lens, where do you expect the GI industry to go? Like, how big will it get?
Yeah, I mean, I think the Optum example, honestly, I don't know if anyone can replicate what United and Optum have just because how big they are. And, they are order of magnitude bigger than even the second biggest player, right? But they clearly are a payvider, right? They want to be integrated payer provider. They want to focus on Medicare Advantage and all of the variants in there as Americans get older. And it's very clear that Optum and United believe that by acquiring physicians, whether it's radiologists or GI or orthosurgeons, through folks like SCA, I mean, they just bought Kelsey Siebold. I mean, they're buying, a physician practice, specialty physician practices, feels like every month at this point. So they clearly have a perspective, which is, I mean, I like to joke that we're going to be in a single payer healthcare system and the payer is going to be called United, not the government. If you don't want to be part of the Optum universe, right? I do think it comes back to that original question. What is your differentiation? Because if you're the best in class facility, if you're the best at what you do in GI, in innovation, you're out there, you've got multiple capabilities, you have choices. You can say, listen, I don't have to go partner or get acquired by Optum or SCA. But the flip side is if you're not, then in a world where basic service might get commoditized, are you at risk of getting acquired or being a target, right? Are you at risk of a private equity firm or Optum coming in and saying, hey, you know what? You guys are good. We'll make you an offer you can kind of refuse, but you should just be part of this giant monolithic umbrella called Optum as we have a Pac-Man strategy to own the universe, right? So are you going to see more GI acquisitions by the likes of Optum? Absolutely. Is that what you as a physician or owner want to do? Chances are probably not, but I think that's where it is a cautionary tale because the jury's out on whether the payvider thing is the right thing to do. If you're a payer and a provider, you're essentially conflicted for any number of reasons. And yet here we are, and there's no end in sight to what United's doing. No one else has really done it successfully. I mean, let's take out Kaiser and Intermountain and some of those vertically integrated players. I think we're, again, early days of that, but I wouldn't be surprised if the next step in consolidation for the Uniteds of the world is looking at more specialty consolidation, right? Just like they did with SCA to start with orthopedics. Then they started buying radiology sites. So they decide to go after GI or derm or ophthalmology in a big way, right? In a big, big way.
They do play in GI. There is one strategic deal out of the mid-Atlantic where SCA, as part of their ownership, so they do play. Again, time will tell on how all this will play out. So Dunstan, as we wrap up our conversation, any parting thoughts, anything that you wanted to share that didn't come up in our conversation?
I think, one of the things that I just want to leave people with is, just the value of the data that GI has. I think, it's one of those rare industries. When you think about all the information you have as a GI owner, as a GI facility, right? I think, if you just look at blocking and tackling, right? What can you do in your practice and business today using the information you have? And maybe it's on a piece of paper, which makes it harder, but what can you do to give yourself a competitive advantage? In a world where healthcare is going to face increasing reimbursement pressure, in a world where Medicare Advantage, which has been a gravy train, is now facing massive CMS pressure, what are you going to do in a world where reimbursements are going to be slightly up, maybe a little bit of inflation, but your costs are going way higher than that, right? What is the competitive advantage? What existing assets, including the data you have, can you do to position yourself better? I think that's the existentialist question that we should all be thinking about in healthcare, honestly.
I'm so glad, we're ending on this note because data is indeed the asset that everybody in healthcare should be focusing on. And I'm glad you brought focus to that. Dunston Almeida, CEO and founder of triValence, thank you so much for coming on the Scope Forward show. It's been very insightful talking to you.
Thank you, Praveen. Thank you for hosting me. Great questions, and I really enjoy your podcast. So keep it up. Thank you.